The Chippewa Valley HSHS Prevea Recovery Task Force officially reacting to the news that Eau Claire's Sacred Heart Hospital will be closing a month earlier than expected. In a press conference earlier today, the group expressing their extreme disappointment in the move and discussed their ongoing efforts to try and make the transition easier.
One focus of the group, the $15 million in funding the state approved to help other area health systems during that transition. News 8 Now's Allison Fergott explains what's going on with that funding.
While healthcare systems are currently working to access that funding, it might be a while before they see it. The money is currently being held up in the Joint Finance Committee, and it might not be accessible for another month.
At the end of February, the state legislature approved legislation providing $15 million in crisis response funding following HSHS's announcement they would be closing in the Chippewa Valley.
We have sat down with Marshfield Clinic, with Mayo Clinic Health Systems to talk about what can they do to access the $15 million that the state is offering through Joint Finance and the Department of Health Services.
It was originally drafted to provide emergency room funding in the area, but a partial veto from Governor Tony Evers made the funds accessible to any health service that meets the area's needs.
Now it's up to the legislature, Joint Finance Committee, to release that money.
But the Republican-led committee wants to see health systems release plans that more closely align with the original wording of the bill.
What's happening is they're leaving it in limbo. The 16 members of the Joint Finance Committee can decide if they're going to release this money or not. Even though the legislature has approved it, governor has signed the legislation into law, they can hold this up. And so that's what we have right now.
Minor said Marshfield Clinic Health System and Mayo Clinic Health System are both actively working on plans to access that funding. But that plan also has to be a long-term financially stable decision for them.
$15 million is not going to go very far. It'll help us immediately. It'll take care of what we need to do, but they just have to be able to do whatever that is. It has to go on forever.
He believes the earliest the health systems could access the funds would be a month, time the Eau Claire community no longer has.
It's unfortunate that we have to ramp our speed up in this whole thing.
The task force and lawmakers agree the HSHS departure is a warning. If it can happen in Eau Claire, it can happen anywhere in the state.
It's very scary. It's very scary and devastating for the people that live in the Chippewa region. But also, it puts us all on notice.
In Eau Claire, Allison Fergott, News 8 Now.
Allison, thank you. The Chamber of Commerce is also launching an education campaign teaching people how they can take control of their health care.